Hello and welcome everyone to Afternoon Tea with Docs, the UK's lifestyle medicine hub where we offer you free access to doctors every single week so that you can have the community, coaching and education, not only to prevent, but even reverse chronic diseases like our patients are doing right now, such as high blood pressure, high cholesterol, type 2 diabetes, heart disease, and even some lifestyle cancers, such as bowel cancer, as well as breast cancer and prostate cancer. Now, if you're new to us and you haven't met me before, I'm Dr. Linda, emergency medicine physician from Sheffield, and I'm also a board certified lifestyle medicine doctor. Unfortunately, my co-host is not here with me today, but for a good reason, because it's her birthday. So happy birthday, Erica. And also it is their anniversary. So cheers for that for both of you. Now we have a very special guest today, and I would love to introduce you, Dr. Anna Negron. We are going to be speaking about thriving with a sustainable blue zone type lifestyle. And I would like to introduce Dr. Negron here a little bit because her CV is incredible. And it's something that we are aspiring to with Erica here, to be the physician that Dr. Negron is and has been for over 3 decades. She was born and raised in Puerto Rico, a board certified family physician in Pennsylvania for over 3 decades, has made cooking with patients integral to her practice. She assists patients in transitioning to a whole food plant-based diet in order to reduce inflammation, to alleviate the need for many medications, and to help prevent or treat a wide variety of chronic medical conditions. She also lectures to family physicians and medical groups about the role of food in illness and medical practice, and about the interaction of multiple risk factors in patients. She is the senior faculty member at the Crozer Family Practice Residency in Springfield and has served as a faculty preceptor since 1996. Dr. Negron is a member of the National Advisory Board for Physicians Committee for Responsible Medicine. She has since 1999 also volunteered in practicing at clinics for the uninsured and underserved, and has long served on the board of directors of the Phoenix Clinic. Her book, Nourishing the Body and Recovering Health, The Positive Science of Food, was published by Sunstone Press, emphasizes alternatives to society's reliance on pharmaceuticals in attempting to address health problems. Dr. Negron has received a Champion of the Community Award, and I'm so not surprised because your CV, Dr. Negron, is incredible. It is a Community Betterment Award and a Phoenixville Chamber of Commerce Leadership Award. Her vision and ideals are reflected in her statement. In my medical practice, as in my private life, I have a clear sense of purpose: to advance food literacy, reduce suffering, and limit damage to ourselves and our surroundings. Welcome, Dr. Negron. Thank you so much for joining us today.
It's a pleasure to be seen across the pond.
And unfortunately, you got the pond weather as well. As we were just chatting, the cold has come to you a little bit, not just the afternoon tea.
It's okay. It's then a good afternoon to be indoors.
What an incredible CV, and we have so much to learn. So let's get started. I would like to ask you, just to jump straight in there, what are the types of diseases that you see reversing day after day in your clinical practice and during your volunteering?
Well, they seem to be the same ones. I mean, people come with overweight, obesity, high cholesterol, hypertension, diabetes, heart disease, and occasionally cancer, because I see working people of the ages between 20 and 60 some.
So are these diseases all have an underlying cause that's the same?
This is what I have come to realize, that we all manifest disease in different ways depending on our genetic weakness or predisposition, because it's not really a genetic determinant, but we're all fueling those diseases with the same food and lifestyle, which is known as the Western lifestyle.
So there is that root cause of these diseases, which is nutrition. It's at the heart of the problem. Is that right?
That is absolutely correct. And it was really shown with the China study, where they mapped the diseases across China and were shown to cluster around the areas where people had more access to rich foods, meat, cheese, eggs, and fried, foods. And it's seen in the everyday people moving from areas of low risk in terms of chronic disease to areas of high risk, and how they develop those diseases right away. You can't change your genes, but you do change the way you treat them.
And so for those physicians and patients out there who are often in the belief, unfortunately, that these diseases are not preventable and not at all reversible, what would you have to say?
Get on with the program. The data is out there. We were not really taught this in medical school. I wasn't. And today, of the 150 medical schools and osteopathic schools, only 20 have their suggested nutrition education curriculum that of 20 hours in 4 years. So the medical schools and osteopathic schools are graduating physicians that don't know this. So they're ignorant about it, which does not really excuse us, because we have access to continuing education, and really our patients already know more than my colleagues.
When you have your patients reversing their diseases and you speak to your colleagues, what is the reception of that information?
Oh, wow. There's really very little curiosity about what is it that I am doing or that they are doing. I nonetheless, I'm in their face, and I tell them, I show them, I bring them references, I give them books, I give them articles, I lecture to them because I offer to give them lectures. However, they're really with their blinders and their time constraints, and of course with the pressures. So very few of them take the time to become better informed.
So over the last 3 decades, you have seen your patients reverse their diseases on lifestyle and nutrition changes, but you haven't seen them on pharmaceuticals. Is that right?
Oh, pharmaceuticals cannot reverse disease. They can only manage symptoms. I mean, this is what happens with diabetes, high cholesterol, high blood pressure. The patient becomes a patient for life, destined to take medications to suppress the high blood pressure, the high blood sugar, the high cholesterol. But once they say, oh, I ran out of medications, their disease is still there. They have never been able to reverse or put their disease in remission.
And with lifestyle and nutrition change, you actually reverse the root cause of the problem. Is that right?
Well, that's correct, because if somebody has reversed diabetes or put diabetes in remission and then goes to another physician and they check their blood sugar and their C-peptide and their blood markers, they don't show any signs of diabetes. So that is called reversal or remission of the diabetes. If they go back to the diet that they used to have and that provoked or turned on the diabetes, of course they can turn it on again. That's why we don't say cure diabetes, but put it in remission or reverse it, because it is a two-way street. Same with hypertension. Same with heart disease. You can clear up the plaques by doing a low-fat, whole foods, plant-based diet. But if you go back to your diet as usual, you start building up plaques again. It's really like a switch. Your genes respond to your environment, to your internal environment, which is caused or created by what we eat.
Epigenetics, like Dr. Esselstyn said, lifestyle is the trigger and the gun to our genes, right?
Yes, we have a gun that's loaded and we don't have to fire it. In other words, our genes, might have the map to create diabetes, to cause insulin resistance. But if we don't challenge it by filling up the cells with fat, we really maintain our insulin sensitivity. Once you load up your cells with fat by eating meat, cheese, eggs, and fried foods, that you've just pulled the trigger. You've created diabetes. However, it doesn't kill you. So it's, I don't like the metaphor of the gun. I mean, you can put that bullet back in the gun. You can actually reverse the effects and put the diabetes in remission.
That's a very good point there. And to bring back the conversation, when you said that it's alternative to what we are doing, but we just concluded that it's actually nutrition and lifestyle that reverses the disease, and it's still called the alternative choice of treatment to pharmaceuticals.
Yeah, that's an unfortunate paradigm that we live in. I might just mention that 150 years ago or thereabouts, medicine split into two arms, the public health and the for-profit medicine that really deals with drugs and procedures. And the drugs and procedures is a machine that continues to feed itself with money, whereas the public health has really been very little funded, and probably all it's left with is seatbelts and immunizations, and a little bit about, just supporting clean air, clean water, but that really has not translated into giving lots of money, subsidies that are given to pharma and to the agribusiness, to the farm, to broccoli, to beans, to rice, to a lifestyle that can be supportive of health, like making people suffer less stress, be able to walk at every time, day or night, in a safe environment. I mean, so public health has been really shrunk to nothing, whereas the arm of medicine that has flourished has been the one for profit. In the United States, bypass surgery is the number one moneymaker for hospitals, raking in tens of billions of dollars a year.
So let's have a look at the most common chronic diseases that we see in our Western life, which is heart disease, and you just mentioned bypass surgery, and another three, but let's start with that. What is bypass surgery, and is it actually helpful in the long run?
Well, heart disease is, let me mention a couple of things. You have a heart attack where the young plaque of cholesterol is being formed and is vulnerable to breaking and throwing all the gunk into the bloodstream, causing a clot. So it's a young plaques that cause a heart attack. That's not where you have bypass surgery. Bypass surgery, or bypassing a narrow area in your coronary artery that is not supplying blood to certain portions of your heart, is done in areas that have become so narrow as to cause you symptoms of heart pain or angina. That's not where you're going to have a heart attack. That's just where you're having symptoms. So you can have a bypass surgery and still be forming young plaques that can break the next day and cause you a heart attack. So bypass surgery is a symptom relieving and sometimes a lifesaver if you have really a large artery being compromised, but it's not really the treatment in the long run for heart disease. The treatment in the long run is to clean out your arteries, which can be done on a low-fat, whole foods, plant-based diet. In fact, it's the only way that we can reverse heart disease. Other diets can do, different things, make you thinner, lower your blood pressure or your cholesterol, but these are just individual toggles. But when you're talking about heart disease, the only one that can really reverse it and make you heart attack proof, like Dr. Esselstyn would say, is a low-fat, whole foods, plant-based diet.
And when we talk about heart disease, that means we are talking about all the vessels in our bodies, which innervate all of our organs and our brains. So when we put a stent in that little narrowing, we are actually not addressing all of the other vessels which are causing diseases, right?
What a great point. Yes, because we have 60,000 miles of blood vessels in the blood in the body. So, half of them are arteries, the other half are veins, and then all the ones in between are the capillaries. And every artery in the body is suffering the same thing. So when a man is having erectile dysfunction at an early age, this is the harbinger of really severe heart disease within 3 years. They may not have plaques there yet, but their arteries are unable to dilate properly and render normal sexual function. But that's also happening in the brain. It's happening in the kidneys. It's happening in your legs and feet. It's happening in your back. It's really a little known fact that maybe up to 10% of chronic low back pain is caused by reduced blood flow to the areas of the intervertebral spaces. So yes, you are correct. We can only put stents or bypass area, the heart, because that's like the heart. But it's happening in every other part of your body.
That's summed up so well. And it breaks my heart because very often I see male patients coming in with extensive heart disease who have had 1 bypass, 2 bypass. And in A&E, I actually asked them in a gentle way about their libido, because I feel that we don't talk about it at all. And so we are not giving these men an option, a reason why to look at their lifestyle and diet. And very often they say, oh, Dr. Linda, actually they first start crying because they feel like they have never been able to talk about it. And here I was in the middle of nowhere in A&E, addressing this issue in a sensitive manner, where they are actually feeling heard. And for the first time, they might have a solution to their problem. Is that something that you have seen as well?
And, words are so important. This problem, erectile dysfunction, used to be called impotence. And it was even more taboo to talk about it. I mean, talk about impotence. What a loaded word, right? So the pharmacy or pharmaceutical industry and the industry euphemized the term, and it created this term erectile dysfunction. And now it's okay to talk about it in public because it's not really impotence. The man is not rendered not powerful. It's something that every other man can have, and that doesn't have the same connotations. And what they've done is create a term so that they can sell their product, and their product is these nitric oxide donors, or Viagra's and Cialis, these products that what they do is temporarily donate a gas that dilates the arteries. It's the the same medication that we used way back when I was a medical student for angina, nitroglycerin under the tongue. I mean, it's still used, but it just donates a nitric oxide molecule, gas, that dilates the artery and temporarily allows blood to flow to the organ. So this is what men are relying on for sexual function, a temporary fix. But because also, now they can talk about it. They can talk about it, and every other man has it, so it must be normal. And I will say normal is not natural. Normal means that it's the norm. Normal means that it's what you see everybody suffer. But natural is what we see in the blue zones. It's the natural occurrence of living to be 100 without disabilities.
I love this distinction between normal and natural. If you don't mind, I will steal that.
Oh, please. Yes. Use it. Use it.
Before we move on from heart disease, I have one big thing that I always go back to, and it makes me very nervous. What we do with these stents, it's not only that we give them misinformation about the fact that this 100% kind of the feeling that this will prevent another heart attack, but we are also disempowering our patients from further looking what they could do with this problem and kind of feeding them into their next heart attack. Is that exaggeration?
No, it's not. I mean, I maybe I won't live to see this day because we will see the light, but it should be malpractice not to tell patients that they are able to reverse their disease, that they can recover health. The sicker you are, by the way, the more health you can recover. This is, speaking about who would be the likely person to reverse their disease or to put their disease into remission. It's not the person who is little sick. It's the person who's very sick. That's the person who has the most health to gain. Can you imagine? Those are the people that Dr. Esselstyn, Dr. Dean Ornish took because nobody else would touch them with a 10-foot pole. And they were willing to, go on a drastic, not surgery, but a whole foods plant-based diet. How drastic is that? Nobody dies from that. Everybody got better. Even in the 1998 study where Dr. Ornish put 48 people, randomized them into controls and the lifestyle, at 5 years, the controls had 5 more heart events, whereas the people in the lifestyle continued to show regression on coronary arteriogram. There's a question in the chat. May I answer that? Somebody asked about the nitric oxide. Nitric oxide is a gas produced in the endothelial cell layer of the arteries. The arteries have a lining on the inside, 1 cell layer thick. And those cells, through a very elegant enzyme, the nitric oxide synthase, are constantly making this gas from the food that we eat, from nitrates in plants. So it's not something that we breathe. The nitrous oxide, which you might be referring to, is the laughing gas that the dentist gives you to make you a little bit, not care about the pain in your mouth. So nitrous oxide is one thing. Nitric oxide is the gas that your arteries produce that make your arteries elastic.
Thank you for clarifying that. So to sum up heart disease, point 1 is that even if you have a bypass surgery, there's nothing that stops you from actually doing the lifestyle changes, even with that extensive heart disease, to help you reverse partially, or even in some instances that we have seen with Dr. Esselstyn studies, completely these plaques. And this is the only way that we can actually recover our vessels. Is that right?
That's right. And you don't have to recover it completely to really recover your normal lifestyle.
Great point. So let's go into type 2 diabetes, something that you see in your clinic almost in every single patient that visits you, and unfortunately in our A&E as well. Let's talk a little bit about that and how our current approach in Western medicine is treating it, and what can we do to actually treat the root cause of this disease.
Well, I'll start with a sort of a joke that I heard a British comedian last night say there are two types of diabetes, type 1 and the type that's your fault. This means that it's really out there in the public that we know that this type of diabetes, type 2, is really man-made. It's really not a disease that occurs naturally. This disease is seen in people who have been living, and enjoying the pleasure trap, enjoying the food of Western civilization, of more meat, chicken, fish, cheese, eggs, butter, ice cream, yogurt, and fried foods. And really, those are the only things that you need to replace when you're talking about trying to reverse diabetes or any of the other chronic diseases.
Unfortunately, we have made our patients believe, and our colleagues, that type 2 diabetes is a genetic disease. But let's say it again. Is it a genetic disease that cannot be addressed with lifestyle?
Well, let me say this. It runs in families, but it runs in families through the kitchen, not through your genes. In other words, families eat the same way. Communities eat the same way. Countries eat the same way. And that's how we see the spread of diabetes. It really is spreading not through genes, but through the kitchen, through our lifestyle.
That's very empowering, because even for those patients who have been type 2 diabetic for a long time, they can do something about it starting today. And how should they start? What would be the first thing that you would advise them?
And let me, just before I do that, say just one very brief thing, that the type 1 diabetics could also do something very important to become more sensitive to their injected insulin. So this is advice for all diabetics. Well, diabetes is not caused by sugar. Diabetes is not caused by sugar. High sugar in your blood is the result of having cells filled up with fat so that your sugar cannot get in the cells. So the culprit is fat inside your cells. When the fat is inside your cells, which goes in without being ushered in by anyone, the cell says, I have enough energy, down-regulates or turns off the insulin receptors. And when the insulin comes, parks itself to open the door and let the sugar in, the door doesn't open. So the treatment for diabetes is stop loading your cells with fat. And what loads your cells with fat? Well, nature gives us food that's really very low in fat. I mean, just think about rice, beans, broccoli, pumpkin, sugar snap peas, all kinds of fruits, apples, pears, bananas, all kinds of legumes, beans, lentils. The fat in natural foods, except for nuts and seeds and avocados, is very low. So you can eat to your life's content. You do not restrict yourself from these foods, and you will be on a low-fat diet. What do you have to eliminate? Well, the things that naturally have too much fat. It takes 7 pounds of milk to make a pound of cheese. Is it loaded with fat? Yes. How about meat? Yes. Can you skin a chicken and have low-fat chicken? No, because the fat is inside the meat. What about an egg? Can I have the egg? And we have placed so much emphasis on low-fat foods that really just lower by this much. They don't do us any favor. So we have to eliminate, that's a scary word. We have to really transition out of, replace meat, chicken, fish, yes, fish, cheese, eggs, and oils. Oh, what kind of oil is good for us? The oil that's still in the plant. So stop using oil, and that would be the best way for you to stop putting fat inside your cells. It's easier understood than practiced. I get it. But really, you never know how close you are to turning the corner. Do it for 3 months. It takes that long for us to get, to down-regulate our taste buds to these drugs, because these are unnaturally present in our environment. We were never supposed to, we in prehistoric times walked about looking for stuff, but we were never supposed to end up in a supermarket.
And that brings us to the blue zones, and how do blue zones actually address these issues, and what do we see that's so different from the Western lifestyle and heart disease, which includes, we actually, with this one short discussion, I must say we include hypertension and high cholesterol as well. So if you address your heart disease, if you address your diabetes with the whole food plant-based diet, you will be addressing the root cause of all of these diseases. So how do they do it in the blue zones, and what can we learn from them?
The blue zones are really, they're doing it by the way. They really did not set themselves to do this. And I venture say that there are many, 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 many blue zones around the world that have not been recognized or identified or singled out. In fact, little known fact, I live in a blue zone of myself. And we could, each of us, live in a blue zone. What do they do? Well, the National Geographic crew with with their interest and their curiosity, they found these people living to be 100, but they really didn't have gyms. They didn't have memberships to any kind of, special places where they could. No, they were just eating mostly plants, except the people who were living in the coastal areas where they would fish, every now and then. They're sleeping 7 to 9 hours without using medications. They're active all the time, which is why they were able to sleep without, using medication. So they're active. They don't exercise or do power walks, but they do walk places, and they dance and they play and they fix their fences and they help each other. They also do not use tobacco and use alcohol to a minimum. Of course, don't use other drugs. They limit toxic stress. And, you can imagine what your toxic stress is and try to compartmentalize it. And they also have something very important, which is that they seem to live in communities. So they had plenty of love and compassion, and, and these are, by the way, Dean Ornish, who is credited to be one of the father of lifestyle medicine. That's what he started people on when he was a medical student for people with coronary artery disease. He started people on a low-fat plant diet, mostly meditation and exercise. And in 1998, this study where he reversed heart disease, and that's what he has continued to do. So these people in the blue zones, that's what they practice. They practice common sense living. They have not really engaged in the, Western diseases of abundance, because they have kept to the roots.
And Dr. Negron, what's your favorite movement that you incorporate into your life?
I walk every day before I have, not today, I have to confess, because it was raining and because I had you to prepare for, and I was a little bit stressed, not toxic stress, just a little bit of good stress. But I walk 45 minutes twice a day. And I move, I used to have a dog, and she trained me well. We used to go out before that I would bicycle, but then, she didn't have a bicycle. And before that I swam. So I've always been active in some sort of fashion. And I garden. I do some exercises, in front of British comedy, which I absolutely love. Those are the things that I do. I do my own housework. I mean, I enjoy getting to know my environment, my landscape. That's not for everybody. Whatever it is that you do, that's what you need to do. But do it in a sustainable way and enjoy it.
I must ask you, Dr. Negron, how old are you? Because you are just a glowing sunshine and you are so sharp.
Thank you. I was born the year that this country started the school lunch program, 1947.
Unbelievable.
So I'm 74 years old.
You're glowing and you're here with us, continuing your work. Are you planning on retiring at all?
No, because I am enjoying, my life has morphed as it has. I've been plant-based, by the way, for 33 years. So, when I had a crisis of ethics and philosophical something, I just said, I can't really be part of this waste and violence and all this anymore. Then I learned about all this nutrition and health. I mean, it all came in waves. So I am forever discovering the next thing, and retiring. I don't punch a card anymore. I don't work for anyone. I work for my patients, myself, the community, for making connections, with anyone and everyone. I love life, except when it really treats me bad.
And even then, I can see, I'm sure you have the resilience to get through it with the positivity that you're sharing with us today.
Thank you. Thank you for the invitation. It's just fantastic.
Now, we would love to hear a little bit about your cooking book and how from that book can our listeners, our physicians, as well as our patients, learn to live their best life. How should they use it? Please do share it here on the camera and talk through it a little bit and what practical steps that they can take from it.
It's called Nourishing the Body and Recovering Health, the Positive Science of Food. I wrote it as an antidote to our reliance on pharmaceuticals. It's for everyone, in the sense that I didn't want to write one for physicians and one for the public. I wanted everybody to have it all there, and it's not a novel, so you can pick and choose what you want. It has information on sugars and lipids and school lunches and the public, and one very important exercise that I do with my patients, which is a virtual kitchen tour, which is the way in which you evaluate your kitchen, and you can have it as a fun exercise among people. Tell me what's in your kitchen, a virtual tour, and by doing that, you sort of like, oh my gosh, do I give real estate to this much junk in my kitchen, or how is it imbalanced, or how could I really? So it's something that takes the focus off people and to the kitchen. And it's got recipes. It has also 25 stories about patients, and they're not just the highlights of my career, but the really good people who their struggles and how they have been able to go back and forth in their zigzag, recovering health or just in the process of. One of them is my mom, and 25 diseases that are common in Western countries, especially the United States, where I'm familiar with, but are absent in countries where people are still connected to their roots and eat mostly plants. And I thought that was really important because, hey, how come we don't talk about the fact that there's no acne in Papua New Guinea, or that asthma is really not a natural disease, that it's associated with, the ingestion of foods that are of animal origin? Or what about cancer? How about osteoporosis? I mean, these things which we have accepted as normal, as I mentioned, are not natural. And I present these 25 diseases with some references so that you get kind of encouraged to look at how abnormal it is that we have accepted them as normal. Yes, and all the pictures are my pictures, the food pictures, and every other picture is mine. I talk even about composting. It's closing the circle, about reducing the waste in the environment, talk about agribusiness, talk about the slaughterhouses, and something that I have not really included because I didn't know that then, but there is a diagnosis, a psychiatric diagnosis called PITS, perpetrator-induced traumatic stress, which is different from PTSD, which is the trauma of the victim. This is the trauma of the perpetrator, how someone who of good moral character is forced to kill for a living, and how that really is damaging to our psyche and even spills into the social fabric of places that host slaughterhouses. So this book is, I'm not about to write another one. If I write another one, it will be something in Spanish, which I owe to my community. But if you cannot get this book, which you hope you can, just write, Dr. Linda, write to me and I'll send you a box and you can distribute them amongst your friends, family, your Zoom people.
Thank you so much for that. Can I ask you, Dr. Negron, to share one of your most maybe closest to your heart stories that you had with a patient with chronic diseases, or with anything at all that you have been able to address with lifestyle and nutrition that wasn't accessible for that patient before they met you?
Well, I'll tell you two very short ones. One was very young, very early in my career of using food as lifestyle medicine. It's a woman who had been using insulin for about 10 years, had had a knee replacement, was overweight, was having all kinds of symptoms. Her sugars were still not controlled, using 2 types of insulin and 2 other medications. And within 3 months because she did take it to heart, she was hiking off all medications. And this to me was like a revelation. I said, oh my gosh, I mean, I was told that once you were on insulin and for 10 years, that you couldn't do this. Revelation. I said, oh my, but yes, it happened. So that was, some years ago. More recently, I see a lot of men who are eating on the go and eating food that's just fried meats. And Mark came to me with high blood sugar of 500. These are mostly diabetics, yes. We did not talk about erectile dysfunction, but you will see that later this becomes important. He was having all kinds of symptoms of thirst and urination and alcohol intake, and had gained about 80 pounds since he got came to this country, which is another story because, you know, migrants are coming here having been displaced from farm country by the United States business. And they come here to the United States begging for a job that can restore their stolen wealth, but they're coming to the robber for this health, so they can't find it, and they're really working from sunrise to sunset and disattending everything else, and now disconnected from the ground. So yes, he spoke to his wife, got on this diet, you know, and I keep saying it's not a diet, it's a lifestyle. And his hemoglobin A1C, which is a marker of how high your sugars have been, came down from 13 to 7 in 3 months. He was never started on insulin because I gave him the chance. And what happened was that during the pandemic, which we all know, things got hard. He lost his job. His wife was tired and couldn't really cook for 2 people, for two different cooks. So started cooking same thing again, and his hemoglobin A1C crept up to 9. So we had another powwow together, and she said, yes, I can see that. I really want to do this. So she's back engaged, and he's back on the right track, which brings me to perhaps my closing comments, which is that we know what to do, we can do it, but we need to sustain it. And sustaining it takes enormous amounts of energy from not just the person. The person cannot do them themselves. It's a very rare person who can do it themselves. We have to support this with community, with medicine, you know, personnel, with so much more. We are really not doing a service to our patients. Sustaining it requires community. And so I urge you to get together, to cook amongst yourselves, to cook and, you know, and take food home and get back next week and do it again and do it again and keep doing it. I know this patient has a chance, but just like my patients formerly who were smokers, it took many tries before they quit smoking, or people who say, yes, I want to quit drinking. You can't just write them off or allow them to throw the towel, at least not too far. Pick it up again, help them back. So, I mean, I have hundreds of such patients.
What an incredible story. And there's so many of them. And I think that's also what's helping you keep going with such energy. That's definitely what's helping us here on Afternoon Tea. The ability to see our patients get better for the first time after over a decade of practicing is a type of energy that cannot be bought and it cannot be manufactured. It's exactly what you said with your cooking delivered in your community. It fuels you to keep going. Before we come to an end, I would like to ask about timing, because this is something we are really used to in the Western world, to get everything instantly. There's a magic pill for everything. And unfortunately, as long as we don't see something happening immediately, we very often throw in the towel, as you just mentioned. So you have set a few time frames for chronic disease reversal, but let's repeat that. How long does it take for a patient to possibly reverse their type 2 diabetes and to help with their fatty liver disease, to start seeing improvement in their angina and side effects from their heart problems?
That's a very important topic question to tackle. First of all, let's remember that it takes about 20 years for us to really work for the disease. In other words, you know, it takes 20 years relentlessly abusing our bodies for the heart disease to really show up. or for the cancer to show up, because there's a push-pull constantly. Our bodies have the map to do it right, and we keep throwing in wrenches. We keep throwing in obstacles. So once you have disease, it can take as little as weeks to reverse your blood sugar, hemoglobin A1C to better levels, your blood pressure within a month, your cholesterol within 1 to 3 months. You can your angina within 7 days. As soon as you start producing more nitric oxide, those arteries that are capable of dilating, they dilate, send more blood to your heart muscle, and you start having less pain. And this happened to one of my patients just 3 years ago, who had a heart attack, had angina, signed himself out of the hospital because he didn't want to have a stent, came straight to my office and said, I want to do this on food. And he gingerly started walking, and within a week, he had no more of that. He had his nitroglycerin with him, but he had no more chest pain. So the complete reversal, complete remission will take, 1.5 years, 3 years. But again, we don't need complete reversal for you to feel better. Isn't that great that you can start to feel better immediately? Your energy, your sleep, your stamina, your symptoms, your pain, your inflammation, all of that starts to go down and disappear. That's nature's way of helping us really stay on track. I think that's just fantastic that we can do that. So we need to support patients through that short time, and then support them through the long haul, because it's easy to just say, oh, I'm fine after a month, and then go back to business as usual.
Within such a short time, not only are they feeling better, but also they are not fueling the disease, right?
Exactly. So you're not anymore adding poison to the well. It's going to take a while for that well to clean out completely, right? It seems, I have read somewhere, don't quote me on this, but if we tag our cells with some radioactive something, it takes about 1.5 years for our cells to completely be renewed. And that sort of makes sense, that it takes a while for all the old cells to be replaced with new ones and all of that. So it takes a while in fact, Emily Dickinson said, I am newer every day. We're not older every day, we are newer every day. Our cells are renewing themselves every day. And it takes that long for the sustained effects, but we start to renew ourselves immediately.
And those taste buds change as well. You start feeling better slowly but surely. And so definitely stick with the program, both for our physicians, but also with our patients. If you need the help, do ask for it, but believe in yourself, because that's what not only going to help you, but also your community and the whole healthcare system. So it's such an important message that we are renewing, we can get better. And I want to actually touch on just one more subject about age, because too often we believe that at a certain age, we cannot make these changes. Can we bust this myth?
I hope we can. We do get older, but we don't have to get decrepit before we die. We can die healthy. We can just reach the end of the line. Those people in the blue zones are 100 without disabilities. We have it within us to keep. I remember my dad got a cut, he was 99, got a cut the week before he died. And you know what the body was doing? Healing. That cut was healing itself a week before he died. So we can do it. We just have to pretend and, and collaborate with the body's, health and immune system. Pretend we're never going to die.
That's the way to live. What an empowering message. Thank you so much, Dr. Negron, for this incredible interview. I really enjoyed it. We hope that we are going to have you back soon, because there's just so much more to ask you. I'm really holding back on all the questions. What an honor to have such an incredible physician and a community member and a mother to all, really, if I may say. You just bring so much of your heart to all of us, even here in the UK. I can feel it. So thank you so much. Can we share your book just one more time? Because I want all of our listeners and all of our patients to know about it. This is where you have to start to read and to get the steps. I can see Mauro here. It's Nourishing the Body and Recovering Health. I can see your pen, The Positive Science of Food. We have added this onto our YouTube channel in the comments, so you can buy it there, as well as, if you can get it, maybe we can get a few copies for you. If Dr. Negron agrees, that would be amazing to fuel the health of our nation and worldwide. Thank you for your contribution. Now, for everybody who has joined us here on Zoom, you have the honor of speaking to Dr. Negron for a few more minutes. And for all of those who has joined us on social media, YouTube and Facebook, and also now in our community area, we will say bye to you, and we hope to see you next Sunday at 5 p.m. again to discuss how you can prevent and reverse chronic diseases, just like we learned today. So thank you once again. Have a good Sunday, guys. Bye to all of you. Thank you so much.